All right, how you guys doing? This is Dr. Jeff McNairy, Chief Medical Officer here at Rythmia Life Advancement Center in Costa Rica. Got some great weather this week. It's really beautiful here this month in January. Things are going great. We have Kyle Cease, the guest speaker, the full house. It's always fun to have Kyle here. He's a great dude, and the guests are really happy. Last week we had Gabor Mate, and that was another sold out week that was amazing. You know, Dr. Mate is one of my medical heroes. His approach is so interesting to working with people that do plant medicine, and just his whole way of interacting with guests going through struggles and trauma and addiction. It was just really great to meet him and hang out with him and learn from him. We have a lot of great guest speakers coming up too. Next week we've got Christian de la Huerta, who's amazing as well. And then after that we have Michael Beckwith from Agape. You guys all know Michael Beckwith. The Rev is an amazing dude also. So I'm just really happy to be a part of this whole project. So what I want to talk about tonight, just briefly for you guys, is how to get your miracle in the quickest way possible. And here at Rythmia, if you guys haven't been here before, we have sort of a way that we look at getting your intentions met and getting plugged back into yourself. And we call it, did you get your miracle? And what that means is, did you learn who you've become? And did you get a new heart, and have you reunited with your soul? And that's sort of like our program goal. And we believe that all disease and all mental health issues and all addiction and all unhappiness and all those things in the world that people deal with, that we all deal with, we believe that that is a result of being unplugged from your soul or from your emotional self. So what we do at Rythmia is we work to get you back plugged into yourself so you can heal yourself. And what that means is that you don't need any special advice. You don't need any external medications. You don't need to be in therapy for the rest of your life. You don't need to go into the psychiatric hospital for a hold. That's what I've dealt with most of my career, working in a psych hospital in LA for years. You don't have to go to rehab. You don't have to sit in group therapy for 10 years. You don't have to open up to people that you don't trust and that maybe don't have your best intentions. What we teach here at Rythmia is how to get everything you need from yourself. And the purpose of our guest speakers and the purpose of our program and the purpose of our staff is to create a really safe environment for you guys to do this. So, but at the end of the day, it's totally up to you. And, it takes a lot of pressure off me as a therapist, because in my career, looking back on it, there's a lot of pressure that the patients would put on me and I put on myself, and that the facility I was working at was putting on me, like, I better figure this out, and I better help these patients, and I better, make them change, right? So it's wonderful to be at a place that's not the vibe. The vibe is creating safety and creating an environment of love, where every single person can do their own work and go deep as they need to. So that's what we're doing here. And we're the only licensed place to do this with plant medicine in the world. So we're really excited. And all you guys that have been here before, how cool this is. And, we're selling out. It's crazy. Like, we can't even build enough rooms to hold all the people that want to come here. So it's going really well. We're happy. We're meeting so many nice people. I mean, every week, everybody's just so cool. It's just increasing the family vibe of Rythmia. So what I want to talk about is, why is it that the Western medical model that we're all used to, why does it take so long to realize your goals and to get better? If I break my arm and I'm in the ER, what the trauma doctors and the ER docs and nurses are they're not saying, all right, for a year, you're going to be, putting this cast on and off to make sure it's okay. They want to fix it quick and get you back going and get you healed real fast. So obviously it's a little different. Trauma medicine is a little different, very different than sort of emotional medicine. However, what I've seen at Rythmia and what I've experienced in my own life is that the route to get clarity and to have peace and to get what you want out of life does not have to be long and drawn out. So I was asking myself today, I'm like, why is it that the Western medical model, it's just drawn out so long? Like, everybody's used to it. Everybody's used to it. Oh, you got to be in therapy for years. You have to, oh, you got to do a lot of work. You got, oh, why is that? Like I started thinking about it, and I think we could all agree that there's a money-making component in most of society, right? The reality is that people have to make money. So the Western medical model is no exception to that. There's a money-making component of going to therapy regularly for years, and also seeing a psychiatrist for years, and also working, with different people for years and years and years, right? And it's like you're paying your therapist bills. And, I'm not saying anything bad about the therapist, because, they're just doing their job. They're just doing what they're trained to do. Most of them are not malicious in trying to keep you sick necessarily. It's the system that's broken. It's not necessarily the individuals within it. So I'm a very big advocate for that, because, all my peers in the field of psychiatry and psychology, they're all really good people. Like I've never met somebody that was like an evil person. But what I have met are people that buy in 100% to the model that they were taught in school, because that's all they know. They read those same books I read, and they studied and took the same exams I did, and the whole thing is set up to draw out therapy and draw out medical care in an emotional mental health arena for months and years. And that's just the way it is. So if you're sick of that, and I bet you are, if you're sick of that, this place here is turning that whole model on its head, because we're seeing the most amazing results after 1 week. And people that come here that have been in therapy for years and have seen psychiatrists for years and have done a ton of work on themselves for years, but are still not at peace, they come here and in 1 week, they're right where they need to be. So I'm seeing it every day, and those of you that have been here before, I see Jane over there on the messages board. You're a great example. You did awesome here, right? Because you've been in so much stuff before, and you came and you just knocked out every issue you were dealing with. Now, don't get me wrong. There's follow-up, right? There's things to do afterwards. You got to stay on track. You got to stay focused and plugged in. Obviously, that's common sense, right? The world is still going on, around us. But if you're not able to plug into yourself and get like focused on what your goals are, you're not going to be able to be successful in your life. So we all have this understanding, right, that the Western medical model, a lot of it's about making money and paying bills for the psychologists and psychiatrists and all the mental health workers. We get it. They also don't know how to move quickly, because the whole system is set up like, if I see a patient in a therapy office for, let's say, at best once a week for 50 minutes or 45 minutes, or if I'm in the psychiatric hospital, it's usually 10 minutes. There's not a lot that can go down in that short of a time. And then the whole week they're not in the office, obviously. So there's all kinds of things happening, and life's progressing with them, and they're making poor decisions. And it's just really hard to stay focused with that sort of model, so it's not something that's really that successful. Also, something I want to talk about, as you guys know, I have a lot of background working with the addiction field. And, I'm always astounded constantly at how the addiction model for recovery has sort of a punishment vibe to it. Now, obviously, we can agree, I'm sure, that people that have struggled with drug and alcohol addiction, they've hurt a lot of people, and they might even have a criminal record, and they're definitely concerning to the friends and family that love them, right? And they're not really functioning well in society. And I've talked about that before in some of my Facebook Lives about what that all means. But the bottom line is, when somebody has an addiction that's serious, that's hardcore, right, in the West, everybody just says, all right, this person's going to have to go to rehab for probably 90 days. And then they're going to have to go to 12-step meetings for the rest of their life. And then they, depending on how strict they are in that 12-step model, then they're going to have to be on medication. And some 12-step groups don't believe in that medication side. So there's those groups that don't. But there's just like, it's almost like this identity of you're screwed up, like if you're an addict in the West, it's like you're irresponsible, which is true when you're using. Okay, so right? But that's not who you are as a person, right? You're doing some irresponsible stuff when you're using, and of course, but that doesn't define you, especially when you come out of that and you pull yourself out of that trap that you're in, right, with the addiction. So with plant medicine, what I love about it, and there's challenges with addiction in plant medicine, but what I love about it is the person that has a history of addiction can reset their neurochemistry. They can, for some of the plant medicines that are out there in the world, you can regenerate and unfold the opiate receptors if they have a heroin or OxyContin addiction. And this can happen in a couple days. So, what I've heard from, like diehard, addiction therapists is, well, there's no way that's going to work because, they haven't learned a lesson. So that just kills me. Like, I think if an addict has destroyed their life and is near death and has hurt everybody that they care about and is trapped in a web of substance abuse and pain, I don't think that they need to learn a lesson through the supportive environment and also through a recovery program that can really help them. I think they've learned their lesson. Okay, I think they've learned their lesson. That's why they're changing. So the best thing that I've seen for people that have addiction, again, the type of addiction that we deal with at Rythmia is minimal. We do deal with it, but it's minimal. And the reason is because with our particular plant medicine, you have to be off of your drugs or alcohol here. And that's the way that we can work with people that have addictions. Obviously, there's a break-in services there that's a little vulnerable patch, but that's for the plant medicine we're using, that's how that goes. Now, there's other plant medicines where that doesn't have to be the case. There's other plant medicines that you can be on drugs and alcohol almost right up until you do the procedure, and it can be very effective for you. But you have to have a very skilled shaman, a very skilled practitioner to do that. So anyway, what I'm getting at is I'm not in favor of the Western model of making healthcare take so long to get your goals realized. And I see that the fastest way to your miracle is through plant medicine and the Rythmia way. And the Rythmia way is, like I said before, show me who I've become, give me a new heart, and reunite me with my soul. Because when you do that, all the other questions you have and all the other intentions you have, those things all get resolved within that paradigm. So for those of you who've been here, you've seen that that's the case. And it's really powerful. Now, people all often ask, like, okay, so I've worked on a lot of my issues before I got to Rythmia. I know that I had a history of trauma. I might have been abused as a kid, but I've done therapy that was helpful to me. Some therapy it can be good depending on the duration. And I've worked on myself through some holistic things. I'm in an age now where I feel more empowered and I have some success and I've made some changes. Is the plant medicine going to drum up all this stuff that I've already fixed and worked on? The answer is no. What it is going to do, it's going to kind of dust down the area that you cleaned up already. So like, when I used to own a construction cleanup business in Hawaii. And by the way, peace to all my Hawaii people for that crazy stuff that happened with the fake signal. Wow. I was like tripping myself over here in Costa Rica for you guys. I'm glad you're cool. Anyway, side note. So in my construction cleanup company, what would happen is they would build the building or they'd build the apartment, they'd build the store, and then my crew of these union workers would come in and dust it all down, just clean off the last little bit. So it was pretty clean before we got there, but we just had to make it nice and clean and just shiny and new. So if you've already worked on a lot of your trauma, you've already worked on a lot of your issues, what happens is you come to Rythmia and you just clear up that dust that's still kind of around, right? So that's what happens for people that have already worked on stuff, and they've got past it. For those of you that haven't had a chance to do that, which is most people haven't had an environment to really work on their trauma and work on their things. What happens with that is they clear it up here in a week. They come, they have an amazing breakthrough. They have clarity on things that have happened. Now, this is the thing. If you have trauma from childhood or young adulthood or even recent trauma, as an adult, it's affecting emotionally how you're behaving in your current life. And so what happens is I'm not always aware that that's the reason why I'm making poor decisions. I'm just kind of like finding myself in the same position I was in my job, every job I take, or finding myself in the same sort of relationship with every new relationship I get. And I say, this one's going to be a different one, right? But it ends up being the same. And it's not functional, it's dysfunctional. So what that means is that the subconscious sort of emotional trauma history is impacting your current life. And so what I say here at Rythmia is that we look at that you get a chance to process that, because your subconscious brain has no need to hold on to a ton of irrelevant emotional trauma from your childhood, because you're not 5 anymore, you're an adult, and you don't need those fight or flight emotions to kick in every time you try to trust somebody or trust yourself. So that's the beauty of this work that we're doing, is you get to resolve and work on all that stuff in a very quick manner. So also another reason why the Rythmia way works and why plant medicine works for people to get things done quickly is because there's a neurochemical response. Neurochemistry is extremely important in mood and our emotions and the way we think about things, what we feel, our connection to ourselves and others. Neurochemistry is basically everything. It's in our brain, it's in our spinal cord. It's what kind of like is the juice that allows us to process things and feel and kind of like run from something if it's scary, or understand things. And it's a very important component of our bodies. So if somebody is genetically born with a low level of dopamine, they often have depression, or they have what's called dysphoria, which is a low-grade level depression. If there's high levels of serotonin and other neurochemicals, there's anxiety. And so what happens too, if people have substance abuse issues, or they're living a lifestyle that's not healthy, they're not eating well, they're not sleeping enough, they're stressed out, the neurochemistry is affected. And that can cause anxiety, that can cause depression. There's things that can be caused by lifestyle. So there's a genetic component for some, there's a lifestyle component for others, there's choices we make. And so what happens with plant medicine is that you get to push a reset button on your neurochemistry. You get to level it out and balance it out. So then when you go home, you're like, wow, I don't need these antidepressant medications. I don't need Xanax to calm down. I don't need Ambien to go to sleep. I don't need to drink half a bottle of vodka to fall asleep. I don't need beers at a party to like feel I can be social. You actually have the neurochemical balance where you can do all those things naturally. That's what's wonderful about all this. So the quick nature of this work is what is raising a lot of red flags for people that are doubtful. Because, and believe me, I was one of those people. I'm thinking to myself when we first, I helped open this facility with Jerry Powell. We were doing plant medicine in Costa Rica, and we wanted to have a place that was really safe and really and medically licensed, and where people would come to, usually first-time people for plant medicine. And what I was worried about is that, wow, like 1 week or 2 weeks, like, I'm used to seeing people for inpatient 90 days. I'm used to working with people in a psych hospital for, several weeks, if not months. My patients in my private practice were, years, some of them. So I was a little skeptical because that wasn't what I was, taught at UCLA. And that's not what I learned in the healthcare field that I was in for 25 years. It was the opposite of that. So what I've seen at Rythmia is the incredible change that happens for people within 1 week. And some people stay 2, but that is a very short time. That is incredibly short. There is so much going on here for people. It is an incredible process that's quick. Now, I'm a big fan of having things happen that are good for you quickly, and having things change that you need to have change in your life. We don't have months and months and months and months and years to work on some of these issues, especially people that have addiction issues. There's a lot of high-risk behavior with people that have addictions. We don't have years to just say, okay, well, we hope he gets better, right? And people that have struggled with mental health issues, with depression, anxiety, and all the rest, they're trapped now. They want out now. They don't want to wait 10 years to finally feel a little bit better. They want to get out right now. And what's wrong with that? Please tell me, somebody, what's wrong with getting out right now? There's nothing wrong with it. We want to heal ourselves quickly and move forward in life. So I invite you to come to Rythmia. This process is incredible. Every single day I'm astounded. And on the weekends when everybody's coming and going for the next session, it's incredible to see the results. And what's wonderful is that the new guests mingle with the guests that are about to leave for like a day and a half, and everybody gets so excited because they see the bright faces that everybody has and the encouragement that they have for the new guests. It's a really good vibe. So if you're nervous about this work, that's okay. Because guess what? Every single person I do their medical intake on is nervous, because it's a life-changing experience. It's gonna get you back on track with who you are. It's gonna plug you into yourself. So I look forward to meeting you. Come down here to Costa Rica. It's beautiful and safe. You're gonna love it. I look forward to seeing you. Pura vida.